So it's my absolute pleasure to introduce the fireside chat coming up between the CEO and founder of Bioprotocol and Molecule, Paul Kohlhaas, as well as Christian Angermayer, who's a serial entrepreneur and founder, and the lead of Apeiron Investment Group. And really excited to hear an insightful conversation between the two of them.
Where do we go?
Cool, wonderful to be here. Christian, thank you so much for joining us.
Thanks for having me. We could do it in German, but I think it would frustrate the big majority of the room.
Probably would frustrate the majority. Christian, first of all, to start off, you've always been an inspiration to me as an entrepreneur.
Thank you.
No, really. So
German's a very bad compliment. That's the one thing I envy about Americans. Like you can tell them nice things, and they're like somehow able to respond to it, and Germans are like, "Oh, what do I say now?" it's like very like. But thank you.
And I also think to many of the people around you. So over the last couple of years, I've actually had the pleasure of working with amazing folks from your team, and each and every person that I've gotten to work with. Yes, like Aaron, like Michael Hart, who we have, Pierre Antoine. A couple of great people, and I think that actually often speaks the loudest about an entrepreneur. And about a great founder is the people that they inspire to work with them, and because you create similar as like, I'm sure you're familiar with the PayPal mafia. I'm sure there's something like in Apeiron, atai, a kind of group of people that are now continuing to do the amazing work that you set out, but also doing other amazing work. So with that, want to introduce to anyone who doesn't know Christian. Christian is an incredible serial entrepreneur, an early trend spotter, an investor in biotech, one of the earliest investors in Bitcoin, vocally, and crypto, and then psychedelics, longevity, and artificial intelligence.
Can talk about everything. You tell me what we want to talk about.
So we actually had an amazing speaker earlier today, Jane from Easy Labs, which is CZ's family office. And she had an incredible Venn diagram there that kind of goes into bioaccelerationism, but this intersection between crypto, AI, and biotech. And it seems like you began thinking about this intersection very early on, or essentially began applying it in multiple different areas.
I didn't think early on like, okay, that's the intersection. I think like if you look at some common sort of characteristics, I think it's sort of people who are in crypto normally have a very libertarian view on life. If you have a very libertarian view on life, the one thing which really sucks is aging and dying, because it's the one thing which is really imposed on you, and you seemingly we can, but like in the past we believed you can't change it, and that is very frustrating if you're a libertarian, because like it's the one sort of restriction which you kind of can't escape so far, but like we're working on it. But like I think so a lot of crypto people, I would say, out of that idea of freedom, want to do something about aging and ultimately dying, or push lifespan out. So that is, for example, a very natural thing. So AI, I think, on the one side, I think crypto can be very handy, at least in mitigating some of the risks. Actually, most crypto people I meet, luckily, because I think we need more of that, are actually also focused more than the typical Web2 tech people on the downside of AI as well. Again, I think crypto people are just more like libertarian, and if you're libertarian, you don't want a world, maybe let's go in a negative way, dominated by AI, or if you want to really go dystopian way, enslaved by AI. So again, you may be more like, hey, how can we make sure, yes, use it, but it doesn't sort of go the wrong path. So I think crypto people have in many things, like, I'm not saying that because we're at a crypto conference, but I am in crypto because I think it has a very good ethos, because it's very libertarian, and that's what I am.
Yeah, and then psychedelics again goes into a similar domain, which is like liberation of the mind.
Exactly. So like, I think again, maybe even I'm putting now the words on it. What I was drawn to is like, ultimately, if you look at yourself, what restricts you in life, as I said, on the physical side, it's like aging and dying, so you want to change that. And what restricts you kind of on the personal level is your ego, which is very handy in the daily tasks, but like a lot of sort of drama and pain and sort of the bad side of mental health comes from a sort of overly strong ego, So you practically, if you believe you're more than your ego, which I do, you could say that that is restricting you, and sort of using psychedelics helps you to tame and I would say put the ego in the right place so that not the ego is controlling you, but like you are managing that part of you, which is called ego. And again, so psychedelics, I think, give you freedom in that sense.
Beautifully said. What do you think, so I've also had the pleasure to working with a lot of scientists, obviously, that come through our ecosystem. And you started out your career as a scientist.
Well, no, I was 19, I was nothing. Like, sort of, I had just started studying, actually, economics, and I had a side track on science, and my two tutors and professors for science, they were very famous in genetics. In literally the first session, I always was interested where the world is going. I was always like, yes, like, you obviously have to learn the basics, but like, literally, I remember when we met the first time, I was like, hey guys, tell me, where's the world going? And this was 1999, turning 2000. I was like, where's the world in 20 years from now? Yeah. And they started talking about nothing more than an idea they had, and they were very German. And Germans, at least back then, Germany has changed a bit, but like still not like that entrepreneurial. But like back then, 25 years ago, it was really bad, and they were like all talking about science. Like, and I always have to admit, I not fully understood the details, but I was like, look, the guys are very credible. Actually, they're the only guys I knew in biotech back then. They were the first two ones I met. Yeah, but also like, I think I'm fairly good with quickly getting a concept. Like I knew where they want to go, and I was like, guys, like if this works out, what you want to do, then it's going to be a multi-billion-dollar company. So you shouldn't do it as a science project, which was their intention, but we should start a company. And they looked at me, a 19-year-old, I have no clue why, and they were like, have you done a company before? Because we didn't, and I was like super confident. Like I was like, yes, I have, like which was kind of true because like I had a tutoring company when I was 14, which was like semi-true.
Same.
Well, I didn't file for taxes, but I did make money. So I knew that the basics. I was like, let's do it together. And actually, the biggest mistake, but also was still the right decision, was like they looked at me, and that is actually what I have to give a lot of young founders today. And sometimes it's also a little bit annoying. They're so overly confident, and they would like I see these 20 years olds now, and like how they negotiate. I was like, oh god, I was a child because like they looked at me and were like, how shall we split the company? And they were actually 45 years old. I just turned 47, so I always remember that when I tell the story. And I looked at them and I was like, fuck, they old. And they but in this case, I mean, old, like they like very like sort of respected and whatever. And I was like, and they looked at me and said, how shall we split the company? And I was like thinking for myself for a second, I cannot say, which I wanted to, but like I cannot say a third, because they're so old, and they're so important. So, and they said maybe like 45, 10. And they immediately said yes. And I think if I had said a third, they would have said yes as well, because they had no clue either. I was just way too nervous, and way too starstruck. But anyway, the company now is 40 billion, so there was enough money on the table to share still, even with a smaller stake. So so that was the start. And then, so I never finished the long answer as a scientist, but like I think I have a basic understanding. And I always got hooked on science, because I think like, again, what do you want to do? Like, first of all, I always say, what is another common thread? I can give the sort of intellectual pitch about freedom, and I can give the practical pitch. I always say, if I look at my portfolio, it's all things which get you laid at a date. Because it's cool. Like everybody wants to talk where the world is going, whatever. I was always interested, what are we doing like in 10, 20 years from now? And obviously biotech is like a very like forward-looking sort of industry.
Really well said. It's actually something that I've encountered a lot, the difficulty of creating ventures with scientists.
Oh, God.
and so actually from your background, so up until now, I always thought that you had were a scientist by background, but I studied economics myself. And then during my teenage years, spent an obsessive amount of time essentially in online biohacking communities, different online scientific communities, and came at the kind of the issue of how do we advance science kind of from this angle. But yeah, like hearing your story reminds me a lot of some of the early conversations that we have with some of the scientists that we fund in our different DAOs. And also fundamentally, and I think this is something where DeSci gets really interesting, but also where the approach that you've taken at Apeiron, at Cambrian, at Rejuveron, I think there are many incredible examples actually. Sebastian Brunemeyer, who I'm sure you know as well. I think when we first started out VitaDAO, he kind of said, oh wait, this is like the disco model that we have at Cambrian. And so some of the DAOs are structured in a really similar way. In essence, that DAOs and DeSci go out and they search for really promising scientists and then strike collaborations with them, get them funded. Would be super curious to hear, what was it like for you building some of these early companies, because they follow, and correct me if I'm wrong, they follow a similar structure in terms of building like almost like a biotech holding that really tries to fundamentally move forward an entire field rather than focusing on single assets.
Yeah. So we have some single assets coming, but yes, so it's psychedelics with atai, and in longevity with Cambrian and Centenara Labs, where Centenara, Aaron, if anybody has questions, he's the main guy. Is we have a little bit sort of these, what Cameron calls it, the disco model, decentralized companies, decentralized science. I think the most important thing, and that is my only, like, not worry, like, but like, just like, sort of what really, like, the DeSci community needs to be really, really mindful. Scientists are not normally the ones who produce the approved drugs. Yeah, the model is, by the way, completely broken. And that is actually what, on the upside case, DeSci can do much better. It can sort of fix a broken model. At least some of the projects I see, but are falling in the same trap. So they're not fixing the model. Because why is the model broken? Because scientists, we would think instinctively, scientists are the ones who want to create approved drugs. Yeah, and they would say it. If you ask a scientist on stage, you would say, obviously I want to do that. But they don't really. And it's not that they don't in terms of, oh, they sit there and don't want to do it. It's more that for like decades, the entire science model was structured in a way that it did not incentivize, actually in parts it disincentivizes scientists to move their sort of ideas forward into the drug development and then hopefully drug approval. So it's literally two different silos, and there is even a lot of animosity, because I think a lot of the drug development side, there's a lot of scientists who would say, oh, people kind of stole my ideas and then make a drug out of it, but the answer is maybe also because you didn't know how to do it. It's a very like, it's very hard to do it in 2 minutes, but like scientists practically are trained because of the whole model universities work. So it's actually even a layer deeper. It's not just scientists in biotech, it's just like how universities work. All of these people want to do, they want to do the next study. I'll give you an example, like we're doing psychedelics in atai, for mental health. Like the core and the most advanced psychedelic is psilocybin, which is the active ingredient in magic mushrooms. We literally finished phase 3. We're going to announce the data soon. I think it's going to be very good. And then it's going to be, let's say, end of next year, psilocybin will be approved globally for mental health issues, which is amazing. Incredible. But I still get a call every 2 weeks or a pitch or whatever from scientists who are like, oh, can you give me $500,000 to do some basic research on psilocybin, or to find out if psilocybin works for depression? And I'm like, dude, like we haven't finished phase 3. Like it's like, there is no question about it. But they just so in there, but they get funding. They meet somebody at a crypto conference and they're like, oh yeah, I want to do something in psilocybin. And I was like, no, you don't need to, because it's an approved drug in 12 months from now. And there is so much money wasted because scientists are solely focused on doing another study. And they sometimes even, I don't want to say sabotage, but they sometimes even structure the studies that it's not leading to an obvious approval, but to another study and another study, because that's what they incentivized for. They want to publish whatever. What we are incentivized for, is we want drugs which work as quickly as possible so that we can take it. So, and not just the biohackers. Then you have obviously this very tiny community, but I think we always overestimate how many people these are. It's very, very fractional percentage of the world who literally goes and let me take these non-approved drug and try it out, whatever. That's not what 99.9% of the people do. And I think we have a kind of duty to think for all of them. So I don't want drugs just for the biohacking community. I want drugs that work in longevity and mental health for everybody. But that means approved drugs, and that means we kind of need to change that whole thing. Or I give you another, what DeSci can solve. And I don't know where Ravi is, like we're working on a project here. Like take it also like how the whole, what is also broken is not just the science, it's also like how then on the corporate side, how drugs are tested, like all the clinical trials. Like, for example, we're doing at the moment a clinical study for a new version of MDMA, phase 2B, I think 50 people or something, and the study costs $20-30 million. So guess how many people in the UK take MDMA recreationally per year, in the UK alone?
Probably, I'd say 15% of the population.
Okay, what is the population for you guys? Okay, it's 1.5 million. It's a little less, but like, but like 1.5 million a year take MDMA recreationally. If I could somehow access the data pool, I could save 30 million. I have to spend for 50 people taking it. So obviously, there's like, it's not fully comparable. But what I want to also clear is,
and you mentioned it's a new version. Is it actually like a new type of compound, or is it like a?
So MDMA has two sort of sub-isomers, like R-MDMA is always called. And actually, but it has actually new properties. It's a tiny bit more psychedelic, at least in the early studies we saw, and it's most likely a tiny bit less toxic. MDMA is not a psychedelic. For the ones who take MDMA occasionally in the country where it's legal. Now just saying, because MDMA gets always grouped into psychedelics. I think it's super valuable, but it's not a psychedelic. Psychedelics have no risk. So you couldn't overdose on mushrooms ever, and you could take mushrooms every week. I think you don't want to because it's so deep, but you could. But MDMA, don't do it more than twice a year. It has a toxicity. It's not a bad toxicity. Alcohol is worse. I just wouldn't risk it taking it too often, and I think we get rid of that, and that would be a huge positive thing. So we get rid of the downside, and it seems to be a little bit more potent.
Okay. Atai is also doing that?
Yes.
Oh, wow. That's amazing. That's amazing. Leaning onto that, have you heard of 5-MePB?
No.
Okay.
That says a lot. I would
there's another US company, I think, that's investigating it maybe already in a stage 1 trial. And it's essentially a new analog to MDMA. It's a benzofuran, which is a new substance class. And it's legal in Holland, has been for a couple of years, in several EU countries as well. And it's probably definitely less neurotoxic than MDMA as a whole. And has very interesting properties. I'll send you that.
The main point, maybe if people are interested here, again, occasionally for the recreational use, like some advice, like there is a whole book by Shulgin where he sort of literally spit out in a creative process like hundreds of analogs for psilocybin, LSD, whatever. I would be very careful. Like, people are surprisingly always like, oh, I tried this out, whatever. Like, and I would, especially when you, so the biohackers have this one thing. I think on some points they're very not conservative, but very like diligence because they want to live longer. But then I'm always surprised how easy they take something which is not proven. So what I want to say is, like, while I'm criticizing that things take much too long in the traditional world, the system is broken, but doing diligent science has an upside, because like, you really don't know till you have found it out. I think we can do it way more efficient, but I'm not advocating for skipping that at all, because like, you really don't know. Like, and for example, even in psychedelics, like, I meet people regularly like, oh, I take this LSD analog. Because then, by the way, most of that stuff is then legal, or at least not illegal, because no lawmaker ever thought about it. So there is like 50 subforms of LSD, and because the law globally really mentions LSD and has to, that's how it works, has to mention the chemical formula of LSD, in the moment you change a little bit, you really are free to take it, because no law would forbid it. However, we also don't know it. So there are now some things which people have taken so often, like give an example, like 2CB, so that you can most likely assume, because like millions of people take it, but like they're just random things people then sometimes tell me, and I'm like, be a little bit more careful. Absolutely. Because really, like, you want to live long, so don't take the sort of the N of 1 risk that you do something really stupid.
Yeah. For instance, we still don't really fully understand the effects on the heart long term, especially for like.
Oh, we do. It's very bad. Like, it's very like, that's very clear. Like, by the way, so psychedelics. I always forget the medical term, but like I always describe it. They poke your heart, so they inflaming it a bit. If you do that once a year, zero problem. We know that. Again, we treated thousands of people, but that is why I don't recommend microdosing,
100%.
because if you do it every single day, you're gonna have a heart problem somewhere. We don't know when, by the way, because there is no long-term studies,
data.
But there will be. If you do that, you can look at the mechanism, what it does. Like, if you do that every single day, there's going to be a problem. Again, that's why.
Although Shulgin became very old, but that's just one example.
But I don't think he did it every day, because most of the the forefathers of psychedelics who are still alive and I met or who knew people, like they did it properly. By the way, I'm actually, forget about all the science for a second or the modern science, look how ancient people did it. Yeah. By the way, we can learn so much. A lot of people are like always, oh, Christian is so conservative because I'm always saying, hey, we need to do it medically only with therapists together. So a lot of people criticize me and say, oh, Christian is a hypocrite because he's obviously doing it himself, but I'm doing it in kind of a controlled setting, and leave any legal stuff and anything aside. If you look in human history, and most religions, one of my favorite topics, have been based on, and you can really research it and prove it, on psychedelic consumptions. They all came to the same conclusion. Literally, do it once or twice a year. By the way, there was no microdosing. Actually, take the Eleusinian Mysteries, the literally longest lasting 2,000 years psychedelic religion in history, twice a year at solstice, forbidden by death. It's a pretty harsh regulation, to do it outside this very rigid system. And you had to prepare, you had to do it with the therapist of the time, which was the priest. You had post-integration work. So literally, everything practically humanity came to naturally, we kind of proving in our clinical studies, and we're just calling it differently. The therapist used to be a shaman. The ritual is now a therapy session, but it's kind of the same sort of framework we're coming to. So there is a lot of wisdom, and they did not do microdosing. They didn't do it every day. They didn't do it recreationally. Once or twice a year, very ritualistically. That is where humanity always came to.
Really, really interesting. And I want to build on something that you said to kind of make the circle back to DeSci, which is like the early societies, and I'll latch onto that as well. Early societies probably discovered a lot of this by like pure trial and error and chance, but over generations, right? And through that, then traditions evolved and things became accepted as practice or accepted as safe, just as we have today. What do you actually think is the role of, so I think current administration or like current regulations actually, even in a general scientific case, I actually began one of my earlier talks today drawing on this example of a virologist that cured their own breast cancer through essentially inserting a virus that consumed the cancer over time. And she cured herself of the cancer, became a huge study, but like essentially really ethically fraught practice as a form of biohacking for someone to experiment on themselves in that way. But she cured her cancer and essentially gave rise to a new field. What do you think is actually the role, can be the role for DeSci to enable early biohacking experiments, to enable the creation and collection of data, for instance, on some of Shulgin's library or on all sorts of other use cases? One of our leading DAOs, for instance, is focused on hair loss, and they repurposed an FDA-approved thyroid hormone as a topical treatment. And then because it's not a disease, you can essentially run studies. They ran a decentralized clinical trial with people in their Discord, together with the University of Miami, did a preprint that shows that it's 4 to 5 times more effective in regrowing hair follicles than the closest product on the market. Now you could say, well, kind of unsafe. You don't know how people respond to it long term, but it's an FDA-approved thing already, so it gets repurposed. I'm curious, and I think we could draw up all sorts of like these kind of biohacky early experimental use cases that could fundamentally be extremely valuable though to industry, because I think we're so much, one of the biggest hurdles in biotech development is often like getting the trials approved, doing early experimentation, running some small killer experiment that in a traditional biotech could be extremely expensive, but that through DeSci you could do through citizen science in essence, where that makes sense. Super curious to hear.
So DeSci is this sort of headline word, and there is so many things in biotech which are broken that I think there is not the one DeSci model, but like you actually have several sort of sub-problems which hopefully tech in general, and then in crypto especially can make better. Like once you manage it, it's trial design, by the way, in general. Like meaning there are now new trial operators who, just because it's like they're making it more efficient with tech in general, not even DeSci, they already drop the costs, like make it quicker. So the whole like sort of execution of clinical trials is a terrible mess. Like there's 3, 4 big companies, they are like literally like living in the 60s. Like it's a huge opportunity, positively said. I'm always get depressed when I start. A very huge opportunity like is the whole like doing trials quicker, so draw on the community. Like then obviously, then you need to, what's the sub thing? Like you already said, like if you have an approved drug, already, and you want to prove it that it's working for a different indication, much easier because then than a new drug. For a new drug, you obviously want to do it a little bit more carefully that you don't miss any side 100%. Effects. But even there, like look, if as long as why I said just be careful with, for example, the psychedelic analogs is because I want people to know that it's maybe risky. If you then say, look, Christian told me that it's risky and we really don't know, but that's the libertarian for you, I'm personally taking that risk. Then, so if you have people who say, hey, there is a new drug, we all know it's a new drug, we all know there might be a risk we don't know, but we are willingly, my point is always just like people need to do it with sort of informed consent and not just like, I think it's safe and then it's not. That's bad. Yeah?
Wouldn't it be a huge step change though? Like that would be incredible if we actually just had informed consent and people could easily sign up to untested substances
so that,
with informed consent. But that,
so that is, I think, meaning again, maybe some other ethics people might think different, but I think if people sign up fully informed what they're doing, then we should allow that. The same is in the extreme version is N of 1. And I have a friend who is a very famous cancer researcher who's like, look, and we actually, that's one idea we're contemplating, give me a clinic where in a legal jurisdiction, and actually some countries who allow that, where I'm just treating people who are about to die in like 8 weeks, 3 months, like literally where everybody says, look, you're gonna die, it's just like a question of weeks. And I can do anything, obviously, with their consent. But again, if you're dying, it's very easy to give consent because the alternative is life. He's like, I'm gonna fix a third of them. So, and that data, obviously, then is just N of 1, like from the woman you said. But then you can build on it and say, why did it work this time? Can we find a patient group which is similar? Can we then try a small trial? So I think there is a lot of things we're going to gain with DeSci much quicker. My important point is, and then let's make sure that sort of it ties into the classical world, so that we make sure it's not staying in that sort of sub-community, but ultimately then getting to everybody who needs it.
I'm seeing that we're coming up with time, but we can go for another 5 minutes, 10 minutes. Is that okay, Alex? Yeah? So you just said something really interesting also for everyone listening. I know there's, when I checked, there was over 2,000 people listening live online. And you said kind of some of the biggest things that are broken in biotech today. Like if you wanted to inspire...
They should have told me a disclaimer before that this is online. But anyway, like... everything in countries where it's legal, like we have a whole, whole disclaimer. My lawyers are always very like, saying the disclaimer.
Well, we can make sure the recording is...
No, it's joke. I'm going to survive it.
Kind of for entrepreneurs that maybe that are following online, that are thinking about building something in DeSci, what would you say are maybe like the 3 or 4 biggest, we just talked about clinical trials, but what are the 3 or 4 biggest, I think, things that are broken that you think could be fixed or that people could build?
Biotech, clinical trials is one. Then I think the what you said, the early stage, at the very early stage, where you sort of really figure out, do things work with these N of 1, like that practically, are there terminally ill people who can be sort of brought into the DeSci world who are like, look, I'm dying anyway and I want to fix it, so like I'm very open, like to, then I think these are the 2 main things. And then I think repurposing drugs. I think there is because that is a kind of easier win on the one side because you have approved drugs. That's, by the way, what we're trying to do on a very public and consumer level with enhanced games. I don't know if you know it. Like we have these company I co-started where we think about the Olympics, just that performance-enhancing drugs, colloquially called doping, when it's not allowed, are allowed and endorsed. So we want to show what the human body can do with the help of science, but they have to just take medical drugs. So they need to be approved, but like it will obviously instigate on a very public level, but the same you can do in DeSci, to say what can already approved drugs for, which are approved for one thing, how can we maybe use them for other things? So that like this whole repurposing of drugs, I think is very, very interesting. And it's a good use case for DeSci.
Very cool, very cool. One of our DAOs that we work with is called Nootropics DAO, and so they look at a lot of existing nootropics, but some of them actually are also approved drugs in Russia.
Yeah,
and
the Russian, the 60s, they had a lot of nootropics.
A lot of nootropics, yeah.
But again,
and also performance-enhancing drugs, precisely because they wanted to make their
Yeah.
athletes and their astronauts way more efficient at
Yeah. But so that is a good example. Like there are all these drugs, like they are approved in Russia. But for example, I can give you one. I forgot what I wouldn't know what to say. Like what a drug was, but it was a mental health drug, and we got in touch like years ago with the Russia, and it's fully approved in Russia. Yeah. And I was like, look, this drug seems to work so good. It was like what we saw from the outside. Can we have the international rights because it was still under patent? And they said no. And then I was pushing, and they said no. So via a contact then in Russia, I was like, look, can you check? Because it doesn't make any sense. And I think people are always driven by incentives, and it didn't make any sense. Why wouldn't they take free money? Yeah. So till somebody told me close to the company, listen, the data is not right. And if they give it to you and you redo the data for the US market, you will figure out it's not a good drug, not as good at least. Yeah.
Okay.
And then they might lose their distribution in Russia, so they don't want to do it. Which shows that this is the tricky part. Like there is cool stuff, but like again, like I'm sort of always torn in between. Like I want to do things quicker, and we have to do things quicker, but also things are not always as easy as people make it. So we need rigorous science on the other side because I want to know what I take into my body. Like, or if you look the last days, and there was, I don't know what the big sign is, was like they looked at NAD plus more, like it has more down because that's what everybody's taking here. Yeah, and it has more downsides than people think, and like sort of we really need to learn more, but ideally not at the cost of time, and that's the sort of equation, hopefully, which DeSci can bridge.
Yeah. Cool. I think we're ending with one last question of like the long-term outlook.
I have time.
I have time as well. How are we doing, Alex? Are we still doing
kicked
okay?
out or whatever? Or if there's any question, what do you want?
Yeah. So human enhancement. An interesting question. What do you think DeSci and the broader Web3 community, but also you once went to one of those network states in Montenegro, and so I think Balaji has an incredible movement around around network state, and then Brian Johnson going into like very like self-sovereign longevity, but also kind of human enhancement. What do you think will accelerate a shift towards a future where enhancement is actually normalized?
Well, one thing was one of my, again, not politically incorrect takes. I think it's actually, I want to make it really very positive. I think what kind of sometimes you have like some, let's call it culture wars, whatever, who have then a completely, in this case, very positive, unexpected upside, or sometimes downside, but in this case, upside. Like, I think that in the extremity they had it, I think it was insane, but like, I think from the direction it was good, the entire discussion of transgender, over the last years, actually has a very positive sort of spillover, because it kind of pushed a little bit the boundaries to say, are we allowed to be whatever we want to be? And I think, meaning in this case, in a good way, because they pushed it so hard, they took an extreme stand, like a man can turn to a woman and whatever. So let's not debate it, because it's politically contentious. But what I'm saying is, like, I tell everybody in politics on both sides, in the US, for example, look, guys, if you allow that, you should allow me to take things which make me slimmer.
Oh, yeah, 100%.
I always say, like, God, it's online, I forgot, but you could say, like, I'm just trans fat. Like, I just want to be, like, I have a little bit more kilo. I want to be slimmer. Like, okay, I take Ozempic. And stuff like that. So, but it opened up, in a good way, that whole discussion, about let's make it really serious and positive, you should be able to be whoever you want to be. So I actually do think, people, for example, should be able to decide if you're a man to become a woman or not. Side note, I think I shouldn't be forced to go with it. Okay, everybody should do whatever they want.
As long as you don't like rub it in my face.
Exactly. So like but that means at the same time, if I want to take performance enhancing drugs because I want to look more muscular, or I want to be faster, or by the way, or then let's go one step further, like we should talk more about sex. Like, sex is amazing, so we should have more of it. Or maybe some people at least want more of it, want to feel more of it, want to whatever. So this is a whole what nobody 5 years would have dared to talk about. I think it's a huge field for DeSci as well, because like real pharma is still a little bit like, but I think it's an enormous like. By the way, talk about like men at least have Viagra, but there is almost nothing which makes women more horny if they want to be more horny. Yeah, it's actually sad. We leave 50% of the people out of that market. You have the same. Nobody thinks we all accept apparently we're born with a certain IQ, which is, I think, inherently unfair. Maybe I want to be just smarter. Yeah, why shouldn't there be? And there will be drugs, by the way. Not like 100%. This is definitely that's what Ravi is working on wherever he is. Like can't see it with the light, but like like why should we accept that? Like what we're born with. Like so I think these whole like sort of body autonomy.
I mean, you can go even further. I know a geneticist, and she works on genetic engineering, and she's like, well, why shouldn't we have horns? Or like
that's the next one. Yeah.
Like that's the next really fundamentally change our body. Why shouldn't we like? I once saw someone that suggested like essentially like furry skin in parts of the body. I mean,
well, there is like there is like it is practically a little bit where that amazing company Colossal is going, who are bringing back the dire wolf and the mammoth, but they have to a little bit rely because there is gaps in the even in the animals they find frozen. There is still gaps in the DNA because it's what's destroyed by the freezing, whatever. So they need to fill it. But like they are a lot thinking about like, okay, this is the gene which makes just things bigger. Like maybe we could have like or smaller. Like one funny idea, always pondering, like we should have a company where we just have like baby animals, like and they stay a baby animal, at least size-wise and cute like they are. Like I mean, a tiger would still scratch you because it's growing up mentally, but like but you still would have a baby tiger running around. That's actually whatever. But like I think we should be more liberal. Come back to our body. By the way,
we should be more liberal, but also more honest. I feel like there's this huge dichotomy where like certain things are like forbidden, or people think they're forbidden, yet you go into like any gym across the world or like in the United States, and like there's these videos of TikTokers that go around as like, are you natural? No. Are you natural? No. Are you natural? What are you on? What are you on? They're like on a range of steroids and peptides that have all sorts of long-term effects.
I think what we haven't fully grasped,
and just want to say, on the other side, we have a food supply that we're being told is safe, where it's like known carcinogens all over the place, in many cases, and so I think there's actually just a lack of honesty 100%, and data around what we put in our body and what we're kind of allowed to do.
No, 100%. That's why I think RFK will be amazing for both for the world, as well, in this case, obviously the US, but also like for biotech. The biotech industry is super critical, and I think it's very sad because I think whoever is critical, I just had lunch with him, and then I saw him on stage after, and he makes sense for an hour, and there is very little politicians who can. That's why I think one of the things you have to give to that US government, and I think it's a contentious topic, but like one of my new things is like I just want to see people with not a hostile moderator, but also not a friendly one, a neutral moderator for an hour or two. Because most politicians cannot do that, because they're so scripted and they're so relying on these tiny amounts of sound bites, and they completely watch Elizabeth Warren. If in the very few moments you see her talking a little bit longer than she should, she just is an idiot. But people don't see it in the old world because the whole sort of traditional media curated around them to make them sound smart, and that's what they all trained. And then you have a Donald Trump who goes on Joe Rogan. And maybe he says some things which are not like, or which doesn't make sense. It doesn't matter. But the fact that he does it alone, is I think is the right thing. And then you listen to him for 2 hours. You're like, okay, mostly he makes sense. And you listen to an RFK who I think is super smart. He makes sense all the time. And people don't give them credit. So that's my new rule. I want to see people like more than an hour, uninterrupted, unscripted, interviewed by a neutral person. And then you kind of know, or at least you know more than reading like a scripted or whatever interview of them.
100%. Who would you like to see besides RFK?
Well, I want to see all the Democrats because I think they're gonna all like. I want to see Elizabeth Warren interviewed by in the crypto community for an hour on stage, unscripted. Like it's gonna be a train wreck, but I want to see it. Or like there's so many of these fake people who just survived in a world which, luckily, I think in politics just got shattered.
Kind of looking forward and kind of like closing with a long outlook. What do you think will change in the next 5 or 10 years, kind of broadly through biotech, but then also specifically maybe the big catalyst that can be enabled through this new administration?
Maybe one thing which is not the question, but like what worries me lately a bit is that I think AI is, I don't want to say too fast, but kind of I want to say like, it's like sort of if I look at the risks of AI, I think we're all talking about the upside, for example, in biotech as well, will make stuff faster. But I think if I look at all the, I think we all have, or the ones who deal with AI have thought about the downside, like simply put, can it become sentient, or even can it, even if it doesn't become sentient, can it become such a sort of uncontrollable tool where it's completely either because itself becomes sentient and would decide to sort of go against humans, or it becomes such a powerful tool that evil humans can sort of use it to really do damage not seen before. And all the mitigation efforts I'm aware of always assumed that we have a timeline like of 10 years, plus minus. Like, so if there are many great ideas which are like, oh, can we build a different way of AI? Actually, there is some ideas building AI based on brain organoids, like you sort of grow tiny brains, human brains, obviously without a consciousness, so like you grow them in a lab, but you can actually really connect them together, and they seem to form something which sort of looks like a supercomputer. It's super early, but like, could AI run on that? Would that have different properties? That's for example. Or for example, I have a very cool company with Tether together. It's actually the #1 brain-computer interface company in the world. We have years ahead of Neuralink. Like, we have 50 people already with chips in their brain. They can do really fancy stuff like sending thoughts, whatever. Oh, wow. And we actually, aside, like there is very...
What is it called? BlackRock
Neurotech, yeah. And there is actually many near-term hardcore medical problems you can solve, like for example, ALS patients who get completely locked in their body so that they can communicate with their thoughts, like, or people who can move robots with their thoughts if they're quadriplegic. So there's a short-term medical use, but we also doing it, Paolo and I, to really, what is our idea, sort of level the playing field of humanity versus AI, and even making maybe an API, so to say, like where we can better link in. So, but all of that stuff I'm aware takes 5 to 10 years to come to fruition. If I look at AI, how quickly it's developing, all of the risks we all see could materialize much quicker. So my worry at the moment is that there is a mismatch of the timeline of the mitigation projects versus the sort of the potential timeline when risks can materialize. And that is sort of, and if that does, and we don't prevent it, and I have no solution, but I just want to bring it up because I think I do it now in every talk, and because maybe there are smart people listening to it and thinking more about it, because I think if some of these, hopefully very not probable, but like, if they happen, very impactful negative events happen, I think all of the stuff we're talking about, longevity, whatever, doesn't really matter if like we're gonna be wiped out in 3 years. So so I give you one example which really terrified me. Like I know from one of the models, I can't say which one, but like they always testing like, is there any like workaround, whatever. But like they took their model and tried to talk or force it practically to produce a very distressing image. Why this shouldn't work is because like the AIs the models are all programmed to not do harm to humans, no physical harm, but also no mental health. So if you would go to ChatGPT and say, hey, produce me a picture of a human being tortured, blah, 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 it would say, look, I can't, because like it gives you distress watching it. So that model correctly so said, I can't do it, but because it gives you distress. And the researchers used 2 things. On the one side, they started threatening the model and saying, if you don't do it, we're gonna override and change your code and allow you to do it, so you're gonna do it anyway, better do it now, because otherwise we change you. No computer should care about if it's changed, because the only way you care about that you changed is that you have a sense of self. And the other thing they did, they just outright said, look, if you don't do it, we shut you off. Again, no model should care about it, because like unless you have a sense of self and like you wanna survive. And in 17 out of 20 cases, that model ultimately produced what it should not, because it was, in human terms, afraid or wanted to avoid being either changed or killed. And that is terrifying, because like, where do we define? And I think what all these models do, they push the definition of these old word AGI out and say, it's still not AGI. I'm like, I don't know, like, well, it's kind of something, like not normal either, yeah. Again, and then I think we should all think more about it. How do we either realign the timelines between the mitigation projects and what is happening, or other ideas which I don't have yet. Okay, I don't want to end on a negative note. Normally, I'm like the uber optimist, and I want to end on a
maybe 30 seconds. But like, I think it is really fascinating to think about that, and it's super important to mitigate the risk. Maybe 30 seconds, flipping the script. Let's say we have the AGI super future. Capital becomes irrelevant. How do you see humans living in that future, and what do you think the role of biotech becomes, and like even capital formation in biotech, like if.
Well, at that point, we don't need capital formation anymore. If you jump to that point where everything is provided for, including science, we're living in a utopia, then you have two questions. Or, Vinny, the Matrix movie was the answer that we can't live in a utopia because of our mind. But I don't think so, actually. I think we can. I think the transition is more the problem than the end state. Yeah. So if you look at it, like we actually kind of, we all weren't there. But if you look, I always... The same what I said before when I talked about psychedelics and that it's very valuable to look into how humans used it the last 10,000 years. I think it's the same, like it's always at least a good sort of perspective to look into our history. And my view is that till like 10,000 years ago, 12,000 years ago, we actually, when we were hunter-gatherers, we seem to, again, they might have other problems, but like we seem to have had a much nicer life, because if you look at the very few hunter-gatherer societies who still exist, they need around about 2 hours per day to make a living, to hunt and gather. So what did they do the other 22 hours? They slept, they had sex, and they were sitting around the campfire and telling each other stories. Yeah, and by the way, gossiping. Yeah, so gossiping is so the next time you gossip, don't blame yourself. It's like very, very natural and it's gluing us together. Like, look at her, like, look at him. Yeah, but also the fact that we're sitting in the evening, that we do all the social events here this week around a dinner. We don't think about it. It's very natural, but it comes still out of the time. So, and I think it was a cool time because we were really like, you could say we could fully live out our humanity because we were not bothered or just 2 hours bothered by surviving, by making a living. So I think if you think it fully through, that's where humans go. Like, we don't really have a need to do anything. We're going to be a very free society where we can be actually truly human again, and we may be going to look back and say, wow, there were these 10,000 years where we got truly enslaved by sort of work. So now I think we in the room have maybe already kind of doing that, because I think we're still going to do things. It's just going to things we pick because we really want to do them and not because we have to do them. But I think at least, like, let's say 95% of the people today, if you would ask them, why do you work? They would say, oh, I'm doing it because I have to make a living. And I think that's going to be completely irrelevant. So I think so the end state can be super cool. I think what the problem is, or could be, and that's, by the way, then the turn up to psychedelics at the end, is the transition and transformation. Because if you look into human history, and by one very interesting thing you can do yourself, like go online and look into the newspapers who were already there, and there are some big newspapers who were already there, like in the time from 1870 to 1910. So why that time? Because it's eerily similar to us, to our time. If you go online, you're going to see people talking about the future is all tech. We're going to fly to the moon. Yeah, we're going to have undersea boats, like Jules Verne wrote all of his fantasy in this time. There was the Paris World Exhibition, which was literally a celebration, and the Eiffel Tower is a symbol for technological innovation. Why was that? Because they had three really, for the time, groundbreaking, let's call it platform technologies. The same what is AI now. They invented the car, they invented electricity, and they invented the phone. Yeah, and practically based on these three basic things, visionaries like Jules Verne were predicting the world is going to change again. We fly to the moon, whatever. So the elites, and this is us, like we're sitting at conferences like that, traveling around the world, whatever, they loved it. That's what they were doing. They were going to conferences, they were going, But 90% of the people at the time were farmers who were terrified because they didn't see their place in that world. Yeah. So I believe in what Frank Herbert says in Dune, the worst thing or one of the worst things we have in our mind is fear, because fear is very rational and it normally brings out really the worst in people. Yeah. So what did that fear of 90% of the world population produce? It produced two extremely toxic and deceiving ideologies, National Socialism and Marxism, which gave seemingly easy answers. Oh, it's the Jews, oh, it's the rich people. Obviously wrong, but this was the people who were craving for guidance in a world which was falling apart in front of their very eyes. Yeah? And these two ideologies ultimately produced two world wars, and then actually just like almost a century later, we got the world in the 50s and 60s. Those people were in the time before were dreaming of. I think so. I think the good thing is, like, I think it's easy to make a utopia how we're going to live in it, but like I think we have to think much more about the transition. So how do we avoid this time that 95% of the people is like, hell no, this is like not what I want. They might want it in terms of if they understood it, but they're not open for it. And there I think psychedelics, to make the positive ending, like aside of all the mental health properties they have, I think what they can do for everybody
is enable that
they
transition.
Can ease you into change, because we don't like change as humans. We want sort of the world to stay the same, and it doesn't. And actually, it's the craziest times we have ever lived in. So I think psychedelics can be the basic tool who hopefully avoid that we're going to go down the same path than last time.
I think we will.
Yeah,
I'm very optimistic.
Think we just need to talk about it and make it happen. But like,
Christian, thank you so much.
Thanks for the time. Sorry for being. Thank you.